Hello, my name is Brian, and the topic that I researched is burnout in nursing and how it can affect job performance and healthcare in general. I'll be going over what causes burnout, the effects that burnout has on the state of healthcare and patient safety, and lastly, I'll talk about ways to combat stress and burnout. Before I do get into that, I do want to say that I never realized how many nurses struggle with this and how much of an impact it is having on the current nursing shortage in the United States. This research paper really helped me to gain understanding of the impact that stressful working conditions can have on an entire profession. A few of the many reasons for burnout in nursing are short staffing, compassion fatigue, and hostile working environments that include violent patients and difficult family members. Compassion fatigue is when someone takes on the stresses and difficulties of someone else. Nurses deal with death and dying on an almost daily basis, and they absorb a lot of that emotion from the patients and their families. This can be very overwhelming and hard on nurses and other healthcare workers. They also deal with a lot of dementia and delirium in patients, mostly in the older population. Some patients can become violent towards nursing staff, whether they mean to or if it's just due to confusion. Now I'll talk about the effects of burnout on healthcare in general. So, about 100,000 nurses left the bedside during COVID. It was a very difficult time for healthcare workers for a number of reasons, including short staffing, lack of supplies and PPE, and just dealing with the amount of death that came with COVID. By 2027, another 640,000 nurses will leave the bedside, which is around 1/5 of the total working force of nurses in the United States. With more nurses leaving, there's an even bigger strain on the nurses that stay, which means their ratios will get higher if they don't have laws to protect them. The WHO reported that 1/10 of patients in high-income countries will experience an error in their treatment. And for each additional patient that a nurse takes on that exceeds their ratio, risk of death increases by 7% for all patients assigned to that nurse. Nurses are eyes and ears for doctors. They are the ones that are supposed to detect changes in patients' conditions, and they can't properly do that if they have so many patients to watch at one time. Now I want to talk about ways to combat burnout. And I want to do this by tackling the problem at a couple of different angles. The first way that I want to discuss is the idea of practicing mindfulness. This means to be aware of the present and let go of past decisions. Nurses are faced with thousands of decisions every day, some big and some small. This can be very overwhelming for someone who is always questioning whether they made the right decision or not. It's important to remember that this can affect mental clarity when making decisions that affect the present. Being confident in their decision making can help nurses to prevent medical errors going forward. Since one reason for burnout is short staffing, how can we combat this? Well, annually around 47,000 to 68,000 qualified applicants are turned away due to the lack of educators. There aren't enough teachers to train the amount of aspiring nurses that are trying to enter the workforce. It is seen all the time, years-long waiting lists to get into nursing programs, even when all criteria is met by the student. Becoming an educator isn't something that everyone wants to do. For one, it's very expensive to obtain the higher education that is required to be an educator. There needs to be a better and wider range of student loan forgiveness when it comes to obtaining a higher education in nursing. There also needs to be better incentive to want to become a nurse educator. A lot of the times nurses make more at the bedside or in other nursing roles than they would as an educator. This needs to change so that more nurses want to pursue this career path. There's a bottleneck effect in nursing, and until they tackle the root of the problem, there will always be a shortage of nurses in the United States. Lastly, healthcare facilities should be implementing programs and resources for their nursing staff Team building and building interpersonal relationships with coworkers through unit-led events is a very effective way to combat burnout. Having someone on your unit that you have a good bond with can greatly impact stress levels when at work. It's important to have someone or someones to turn to that the nurse can trust, someone they can ask for help without fear of rejection. Units should also implement incentive and appreciation programs to show the nurses on their units that they are valued and appreciated. These are just a couple of ways to combat the things that are causing such burnout in the nursing profession. And I'm sure there are a lot more ways that are not covered in this PowerPoint. A lot of things need to change in the coming years, given that so many nurses are leaving the bedside and the next generation of baby boomers is starting to get older. Otherwise, there could be a real crisis in the next 3 to 5 years in healthcare. Thank you for listening.